All right, Kentucky, it is 5 o'clock, the time we come together every single day. So many of us all around Kentucky coming together to be together, even if apart, for just a little bit and to reaffirm that we are going to get through this and we are going to get through this together. So say it with me. We are going to get through this. No, that's together. We are going to get through this together. Now, I'm going to try to do the last part with you. We are going to get through this together. We're going to get through this together because we are committed. We are to doing everything it takes to defeat this virus, to protect so many people out there. I get that we've already been at this for a while, and we've been cooped up, and I understand that. But these are the critical weeks, and I know we are resilient. I know we have what it takes, and we know that right now we are in the challenge to our generation, and that we are committed to being remembered as that generation that cared more about each other than anything else. This is our chapter in history, and we are going to make sure that it is one where people remember, and that our history books show that we did the right thing. And our history books here in Kentucky will show that we did it better than just about anywhere else. That's what you are doing, not me. That's what you are doing. And for that, I'm eternally grateful, and I am so proud to be your governor. Now, even with a little bit of noise recently, I've never been so convinced that previous divisions are no longer here, that there is no Democrat or Republican, just Americans against this coronavirus. And we are more united than we have ever been in my lifetime. And my hope is that not only gets us through this and gets us rebuilding our economy in a strong fashion, but I hope we stay united or more united after this, remembering the compassion and the caring that it took to get through it, and remembering how important our fellow human being is. We're going to get through this because we're going to follow the 10 steps that we talk about every day. While I always talk about it every day, I'm sure many of you are more excited about this than when I used to read through all the actions that we had taken. I'm just going to mention a couple of them today. Obviously, stay healthy at home. The number one directive: you shouldn't be anywhere other than home or work or getting essential supplies or getting exercise. Home is where you are most healthy. Home is where you keep other people healthy. You stay home, your contacts don't end up, passing through other people and resulting in the harm or the death of a person. You staying home is a heroic gesture, and it is exactly what our Commonwealth is asking and what our nation is asking. Avoid crowds and gatherings. Again, no exceptions, and you all have been phenomenal about it. Phenomenal. We look at the last week, and I think there is only one or maybe two confirmed mass gatherings at all throughout the state. Think about that. Think about that. That means that we have been able and committed to doing the right thing at a level that I've never seen before. It shows discipline, it shows buy-in, and it is incredible. Practice social distancing. This is just to remind you that the 6 feet isn't an excuse to all get together, but be 6 feet apart. It's about when you're in the grocery store or when you come past somebody, when you're jogging or otherwise exercising. Let's go to wash your hands. That's, again, no cheating, 20 seconds each time, soap and water, and multiple times a day. After we're this far into it, maybe you can get a little lax. Well, this is kind of the peak of the virus. So you know what? Do it more. I mean, when we look at different numbers that we've seen, do it more. And surface as well. Make sure you apply for benefits. And while there is some frustration out there because we have more applications for unemployment than we've seen in our history, yesterday on Easter, the state processed 100,692 payments for $50.45 million. So these dollars are going out to help you. I want everybody to apply for unemployment if they qualify, and for Medicaid, because I want to make sure you have what you need to get through this. Again, this is something that's turned our economy upside down, our way of life. I want to make sure that you have what it takes to get through, and then we will rebuild. And you know what? We're going to do that together, too. Finally, do not travel, and do not give other people a reason to travel. Remember, we are doing better than other states, and every time we invite people from other states in, it frustrates everything that all of you are doing. We always talk about the 10 steps plus one. Fill out your census. We are close to 50%. We need to do a lot better, but we are close. This is your legal obligation. It needs to be done. It will also help us rebuild afterwards. Again, we're at home, right? There's no reason for us not to do this. It's going to be incredibly helpful. And we have some parts of the state that we need to do a little better, and most of them have less internet access than others. But if we can all pick it up, and if we haven't done it yet, commit. Do it tonight if you have internet access. Let's try to raise a percentage tonight. Think we can do that? If you can, why don't you, when we talk about social media, why don't you light up social media tonight talking about how you completed your census if you haven't yet, so that other people can see it's being done. This is going to be a big help, a very big help to the rebuilding that we're going to have to do. And then the other thing that I ask you to do before I get to that, I talked about how we were going to get through this together, but every now and then we've had some other people sending in their comment on that.
Hey Lily, how are we going to get through this work?
We're going to get through this. We're going to get through this together.
She may have been talking about homework, but I still think she's talking about the challenges that are in front of us. And this is just a part of what we've been asking you to do. And you know what? I saw a little bit of criticism on this, but I think this is one of the most important things we do here. Every single day, we talk about what we need, because it's all of our behavior following the recommendations that save lives. Every time I show the social media, it's about behavior that saves lives. So I think this is one of the most important things we do. Then if showing a couple of them gets people excited that they want to put it theirs online, then that's exactly what we need. Every time you post something, every time that you show that you can not only enjoy your duty, but that you're proud of doing your duty as a Kentuckian, as a patriotic American, it helps other people do the same. Here are hashtags: Team Kentucky, Together KY, Patriot, and Healthy at Home. So let's look at a little bit of what we have today. All right, this is 100th birthday. And the photo to the right was taken, obviously, before the coronavirus. They're talking about how the last birthday would have been. But think about this. Grandma here is celebrating her 100th birthday. That's something that so few people ever get to experience, and so few families ever get to celebrate. But this family is social distancing even on that spectacular day. Why? Because they want Grandma to get to 101, and so do I. This is, again, just that sacrifice you see people making. So everybody out there, don't frustrate this sacrifice. Don't. Think about it being amazing, and you ought to be doing it too. I thought this was pretty neat. This is our first responders, our firefighters, also honoring those that we have lost and showing the color of compassion in their firehouse. These folks are heroes. Frontline workers are heroes. And you know, the families that have lost loved ones that can't go to a funeral in the same way that they would have before, you know, they're heroes too. And to see so many of them come forward and to just ask people to follow the rules to protect others is turning tragedy into triumph, is showing the very best of us. All right, I love this one. So this is one of our Morgan County JAG students who is grocery shopping so that the elderly members of her family do not have to go out in public. Look at this. This is this generation, right? A generation that some people would write about, you know, just stayed on their phones or were only interested in themselves. That wasn't true. That might have been something that was popular or in pop culture, but look at this. This is her taking care of other generations. It's special, and when we start coming out of this on the other side, we're going to need to see a lot more of this. And then we just see, whether it's signs or chalk art or other things out there, people being excited about what we are doing together, and we need to keep it up, right? We're weeks in. It can be a little bit draining, but this is the type of thing that people drive by, and they take a picture because it means something to them. Brings a smile to their face. It gets them ready to go again the next day, which is what we've got to do, mentally, emotionally, and physically strong. I think this is pretty neat. This is Lexington's Castleton Lions Thoroughbred Farm. Again, honoring those that we've lost. Isn't it amazing how everywhere you look, almost every neighborhood now, the people are doing this. Frankfort's kind of in a valley, and I can look up at the top, and I can see people's green lights. It's pretty special, and it lets people know that they're not alone. So keep doing it. We need more people to do it. We also need you to ring those bells every day at 10 a.m. Look at this. April distance brings May existence. Just a good reminder that the stakes are high and that the distance that we have between us right now is what's protecting us. All right, just another example of a class coming together on Zoom. Just because we're social distancing doesn't mean we're isolated. We have more technology than ever before, and this has never been more important because our kids need to be active. They need to be intellectually involved and stimulated. Thank you to all our teachers. And you know what? Thank you to all our IT folks at each and every one of these schools and school systems that helps make this happen. Another group that we did not appreciate enough. Actually, probably most of the time you would see them as something wasn't working. So by the time they came in, you were probably annoyed. But look at what they do. So let's thank them, just like we're thanking everybody else as we go forward. And then the next is, we've shown a couple videos about folks talking about the Team Kentucky Fund, which we're going to talk about on Wednesday. This is Bellarmine's basketball coach, Coach Davenport.
My name's Scott Davenport. I'm the head basketball coach at Bellarmine University in Louisville. But first and foremost, I'm a Kentuckian just like you. And we need every single Kentuckian to step forward. It's like coaching basketball. Step up for our team. Check on a neighbor. Check on a distant relative. Do something good. Make others better. That's what extraordinary people do. We need everybody to be successful and to beat this opponent, to take this virus down. Keep our distance, stay in, and look out for others. Now, you want to help? Donate.ky.gov and help. Help others. It's affecting everybody. Do we need everybody? Yes. Do we make sacrifices? Yes. We're all making them. I lost my father. I was 9 years old. Now, I'm keeping my distance. 4 minutes, she lives 4 minutes away. My beautiful 18-month-old granddaughter, Wren. I've got to make sacrifices. Only through FaceTime or from a far, far distance. You can make the same sacrifices. Do it for the greatest state in the Union, the state of Kentucky.
Coach Davenport has me fired up. All right, now something that we started doing several days ago, and it's because so many people watching had noticed Virginia and really appreciated the fact that because of her, everybody was able to get the information they needed. So each time, Virginia is going to teach all of us and me a little bit of sign language, knowing that something good can come out of this each and every night.
We're going to do today healthy at home. Now, some of the sign languages touch your face, and we're trying not to, so we're going to do it. It goes from cheek to ear. So healthy. This is also strength and courage, but it's healthy at home. Okay? Healthy at home.
Thank you. I also loved we learned how to do strength and courage. It's what it takes to get through this. All right, let's talk just a little bit about where we are. Kentucky, you are flattening the curve. And what that means is you are reducing the number of cases we have right now. You are making sure we have the healthcare capacity to care for the people that need it. You are saving lives. And every modeling that we saw before any of this, it's all just people's best guesses, and we still don't know exactly where this is going. There's a whole lot of talk about what point we're at. We'll only know it when we know it. But what we are absolutely certain when we look at the data is that you are flattening the curve, and we gotta keep it up. It means 2 weeks ago we were doing better than others. We do better today. 2 weeks from now, we will be in better shape than others. This is something that we can take pride in, and this is something that protects the people around us. Remember, just one of the models showed the difference between us following these rules and regulations and not. Could be 11,000 plus lives, and I still believe that. Even with the different modeling that's coming out right now, it's how important this is and what it means. I just wanted to show you something briefly from the Kaiser Family Foundation. It's a way to track different states. These are us and I think all of our neighbors, but maybe West Virginia. And can you guess which one is us? It's the very lowest line. So this is looking at Indiana and Ohio, states, Tennessee, all around us. And this ought to tell you that we are working really hard. But it's also a reason why we can't have people traveling into Kentucky. That every time we have something that brings people in, it frustrates a little bit of what we're doing. And this doesn't account for amounts of testing. I know we hear that different questions on that, but what it shows is just another example of how your work is working. But let's make sure that all that does is inspire us to continue to do it and to do it well. All right, couple updates. Very first one, today we had our first day of testing with our new partnership with Kroger. Again, that partnership is aimed at ultimately trying to test 20,000 people across the Commonwealth in multiple locations. Kroger is doing this on their end for free. That's incredible. They are donating the man and woman power. They are providing the PPE that their people are wearing, and they do the setup. The Commonwealth of Kentucky contracts with Gravity Diagnostics. This is our second contract with them, and they're coming through, and UPS to ship back and forth. We opened up yesterday who was going to be eligible to do it, and we'll talk about this again in a minute. So today went well. We tested 97 people. Because of how that went, we're going to be able to do an extra tier today. I think Dr. Stack will talk about that. That's not just what's here. It's also who is symptomatic. I want to show how you sign up. There is a website and a number. So if you are in Franklin County or any of the contiguous counties, you can sign up tonight for testing tomorrow, and they'll be testing the next 2 days as well at this location. We'd love to get 200 plus tests done each of the next days. And we, if you are needing a test and fall in one of those 3 tiers, need you to sign up. This is another step on how we make sure that we are building our test capacity, but also helping those out there that need it. And Dr. Stack, if you can talk a little bit about Tier 1, Tier 2, and Tier 3, also called Priority 1, Priority 2, and Priority 3.
Thank you, Governor. So the criteria that we're using in the state are a little bit different from what the CDC criteria are. So Kroger is using the CDC criteria, and they call it Priority 1, Priority 2, and Priority 3. All 3 priorities require you to have symptoms, and the symptoms they've defined are fever plus cough, shortness of breath. So fever plus cough and or shortness of breath. Those are what they've defined. We use diarrhea also for part of our criteria in Kentucky because some people have a gastrointestinal syndrome instead of the respiratory. So priority 1 would be hospitalized patients or healthcare facility workers with symptoms. Priority 2 would be all the high-risk categories we talk about, and the CDC uses over 65, plus all the chronic medical conditions we've talked about: heart disease, lung disease, kidney failure, immune system compromise, such as HIV or cancer, any number of conditions. Priority 3 are people who don't have high-risk factors but who have active symptoms, which would be fever plus cough and or shortness of breath. So if you have symptoms that could suggest you have coronavirus, even if you're not in a high-risk category, they'll make the testing available to you because our goal is to test as many people as we can with the capacity we have available. Well, thank you very much.
First responders too, which are up here, also within those categories. So go to the website. There is a tutorial on our KY COVID 19.ky.gov that you can watch. Sign up. This is capacity that we want to take advantage of. I want to talk just a minute about an update on the field hospital we are putting together on the fairgrounds in Louisville. We're going to have a bigger update on this on Wednesday, but the National Guard is doing a great job. We now have 250 beds that are on site. There is more work to be done, but this is actually ahead of schedule because of their hard work. 250 beds is just a start. The good part about this facility is that we can significantly expand it if needed. It's meant to serve a number of roles, but most importantly, it's there in any circumstance if we need it. If it's an emergency with a nursing home and there is not the ability in time to have another facility, if it's close, we have this facility. We have this facility if we have folks that don't necessarily have to be in a hospital bed, but are maybe just a little too sick to be at home or don't have that home they can be in. So this is very flexible. We're going to be able to give a bigger update soon, but I want to thank the members of the National Guard. We are close to 400 strong that are deployed. They're going to be able to staff this. They are transporting patients when we need them. They are helping at food banks. They are doing so much. I'm very proud to be the commander-in-chief here in Kentucky, and their work is not only so good, it's so fast, it's so efficient and effective. We've always been said to have one of the best guards in the nation. I think we have the best National Guard in the nation. Also want to mention with all of this, we talk about our Department of Public Health a lot. We also have emergency management. Emergency management, Mike Dossett being the head of that, are doing a phenomenal job, working long hours, doing things that none of us have ever had to do. Working directly with me in the governor's office. They are a real credit and a big part of Team Kentucky. We appreciate all of them. I want to talk a little bit about PPE. We're going to have our longer discussion tomorrow, and it's for a good reason. It's that we've had a number of donations, significant ones over the last couple days that are going to very much change our numbers, that we would still like larger numbers. But first, let's look at the donation slide. Remember, PPE is absolutely critical. It's that protective equipment for our frontline healthcare workers, for those working in a nursing home with COVID-19 patients. It's what tries to help us make sure that those caring for coronavirus patients don't come down with the coronavirus. And we have three ways of trying to get it. Number one, try to buy it, which is incredibly hard right now, and you can read stories about that everywhere. It's not just us. Number two is trying to manufacture it, and we're having some luck on that, especially on things like face shields. And then number three is donating it. And you across Kentucky have answered the call in an incredible fashion. Just to list a couple, and then we'll have more tomorrow. Ford donated 50,000 surgical masks. Old Kentucky Chocolates, 25,000 pairs of gloves. GE Appliances, 100,000 surgical masks and 100,000 pair of gloves. Toyota, 10,000 N95 masks. That's really important. UPS, 10,000 N95 masks. Father Jim Sitchko, who called and said he had a line on these. And admittedly, I know he works for the Pope, but we had a lot of stories about people who thought they had a line on it. Well, guess what? Father Jim came through and was able to provide 7,000 N95 masks. I hope I wasn't the Doubting Thomas. Incredible work. We greatly, greatly appreciate you. Meyer, 4,000 N95 masks. And then our 12 state-operated area technology centers and the Kentucky School for the Blind have donated the following: 9,787 N95 masks, 623 face shields, 162,000 gloves, 1,906 isolation gowns, and 961 boxes of surgical masks. And listen, that is all great, and we need it. Now, what we have overall is not nearly enough. This doesn't solve the shortage. But what really helps us is those of you that may have 10 or 15 or more, that you drop it at your Kentucky State Police post or one of the area transportation cabinet hubs and look more. Keep looking. Donations right now are driving what we have, and tomorrow we hope to be able to give you accurate numbers, which with the recent donations wouldn't have been today. And then Dr. Stack's going to talk through how we divvy these out when we are able. All right, let's talk about our numbers today. And there's some good news and some bad news in just about every day. The good news, and this kind of happens Mondays. We've had lower numbers, and Tuesdays have come in a lot higher. Maybe about the weekend, but we have 87 new cases today. And when again we've found some additional folks who live out of state or who were double reported, our total number of cases in Kentucky is now 2,048. So we have gone over 2,000 cases in Kentucky, which we always expected to do. But it is another benchmark that says that this is a very serious virus. The new cases by county are 28 in Jefferson, 11 in Butler. Butler's been hit pretty hard in one of their nursing homes. They are doing a very good job of responding and within that home. 6 in Bullitt. See, Bullitt has also been hit pretty hard. Different contacts that are there that give it the potential to be another area where this thing can really blow up and spread. 4 in Boone, Kenton, 3 in Fayette, Graves, and Oldham, 2 in Christian, Grant, Hopkins, McCracken, Muhlenberg, and Woodford, and 1 in Boyle, Callaway, Davis, Franklin, Grayson, Jessamine, Laurel, Madison, Perry, Pike, Russell, Taylor, and Warren. Total number of tests that we can confirm, 26,683. Total number ever hospitalized, at least 673. Currently hospitalized, at least 299. It's almost 300 people in the hospital right now. Let's make sure that we're thinking about them. Ever in the ICU, at least 259. Currently in the ICU, 136. That doesn't mean all these people are on ventilators, but the ICU is for intensive care. It's the intensive care unit. So let's especially try to lift those people up and also their families. Numbers recovered, at least 629. So the harder part is today we have 7 new deaths, which brings our state total to 104. That means we have now lost over 100 Kentuckians to the coronavirus. So let's make sure for these 7 and all 104 that we light our houses and our places of business, our institutions up green to make sure their families know that they are not alone. It's a color of compassion and renewal as those people's spirits move from their body to a better place. And now that we've lost 100 people here in the Commonwealth, starting tomorrow morning, we're going to fly our flags at the Capitol at half-mast. It's to recognize those 100, the first 100, and we're going to do it for the next week in honor of these Kentuckians, because every Kentuckian we lose is one of us. And even if a report is 1 or 2, it is still a loss to all of us. And so to the families of these 7 people, we are very sorry. And our commitment, and I'm talking on behalf of all Kentuckians, is to do better. We're trying really hard to do all the right things, but you've lost a loved one to this virus, so our commitment is to do better for everybody else out there that is at risk of this virus. We will work hard on it. The new deaths by county includes a 70-year-old female from Jefferson, an 81-year-old female from Muhlenberg. Muhlenberg hit pretty hard as well. 84-year-old and a 67-year-old female from Jefferson, 70-year-old male from Laurel, and an 81-year-old female and an 81-year-old male, all from Jefferson County. So 104 Kentuckians, 104 too many. Let's make sure that we honor them by our actions and by ensuring that we're protecting everyone else that is out there. Race, and we will add tonight ethnicity of all cases. So we currently know 70.29% of the racial breakdown of cases, and of that group, 81.8% is white, 11.23% is Black or African American, 2.41% is Asian, and 4.41% is multiracial. On ethnicity, it's 94.33% non-Hispanic and 5.67% Hispanic, and the universe that we know is 62.92% of that total number that we know the ethnicity of. We're working on trying to get that higher. Sometimes the paperwork isn't fully filled out, but we want to give you what we have. On deaths, and this is where we see a lot more disparity. We know 81.73% of total deaths, we know the racial breakdown. And of that, 77.65% is white, 21.18% is Black or African American. That's significantly higher than the percentage of the population. And it's 1.18% Asian. I've talked before about some, and I've probably only mentioned some of the likely underlying reasons here. We should have been doing better in our healthcare system and in our world. And I hope coming out of this that we commit to doing that. We know 81.73% of the breakdown of ethnicity on deaths, 98.82% non-Hispanic, and 1.18% Hispanic. Again, while a good day, and who would have thought we'd say a good day when we only have 80-something cases? But now we know, again, we're in the escalation. We'll see what we have tomorrow, and if it's just going to balance out. But again, overall a good number for where we are. But going over 100 deaths today, I hope just reaffirms our commitment to doing what we need to. Okay, some of the areas that we've talked about. First, Western State. We have no new cases to report today. However, we were able to do 139 additional tests today to try to protect the residents of that facility. Now, those aren't all of them, but that is a large group of tests targeted towards those that were most likely to have been in contact or who are the most medically fragile that we are concerned about. So we will likely have an update on that, but it will be because we were able to take some proactive steps. Green River Correctional Complex, one more case. It is one more inmate. So just one additional case. We knew about this one or thought it was coming last night. The fact that we don't see a significant increase, at least for today, is good news. And then our long-term care facilities. Again, it's an increase, but the rate of increase here is a little bit less. We had some of the results that are coming out now in our previous day's results, and I think we'll have more though tomorrow. You see more and more news here. This is where the virus is deadly, and all over the country this is where it's striking. You see in virtually every state is experiencing the same thing that we are, and we're all working collaboratively as states in how we respond. So we have 10 more residents of long-term care facilities, 14 more staff, and overall we've had 5 more deaths. This is our most vulnerable population. And so it's not necessarily surprising that a little under 30% of our deaths are in one of these facilities. But this is why we follow the rules and restrictions so carefully. It's that if we don't, we will come in contact at some point with someone that works or is going to be in one of these facilities for some reason. And the people in these facilities are absolutely counting on us. Let's make sure that we don't let them down. And that 100-year-old grandmother that we saw today is here next year as well. Now, I just do want to point out that there are a lot of different circumstances within some of these numbers. We have some facilities that just have staff members that may have tested that may not have even been around the facility during the time that they tested positive. We have some other facilities that were able to do significant testing, but even in the whole facilities, nobody needs to be hospitalized. They're all in stable condition. We have some facilities that are big enough to where they've been able to create a separate wing to take care of folks that, again, are stable. But being in one of these facilities, first, you want to make sure they're not with everybody else. And second, that you can give them more attention. And then there are those that are in need of being able to be moved. Remember, it's in some of these more intensive facilities, it can be harmful to move somebody too. And so it takes a lot of medical judgment in making the right decisions to protect our folks. All right, we've been going about 35 plus minutes. We'll turn it over and we will go through questions. My plan tomorrow is to do the deeper dive I want to do today into PPE. Personal protective equipment. That'll mean Wednesday we'll talk about the Team Kentucky Fund, an update on what we've raised and how we're going to spend it. So today we've got 3 of our reporters that have been here a bunch. Phil Pendleton from WKYT, Mike Valenti from Lex 18, and Joe Sonka from the Courier-Journal. And we'll start with Phil because he's sitting the closest.
We've had several people question, sending state police to mass gatherings, specifically the churches. Would you have state police go to some of these other large gatherings, such as a business or maybe even a health clinic or other facility where there are people congregating, or you're getting complaints about people congregating?
The question is, have we sent state police or others to any type of other mass gathering where people are congregating or not congregating? The answer is yes. We've cited 18 businesses, at least through the labor cabinet. Nothing we've done has singled out churches whatsoever. This isn't about church. I love the opportunity that church has that so many others don't in doing virtual and drive-in services. And oh my goodness, we had incredible drive-in services all around the state. In fact, and I'm gonna mess these numbers up a little bit, I think on Sunday there were 30 plus calls to state police around the state to go look at mass gatherings. And you know what? They found that in all but one of them, statewide, people were following the rules and the regulations. That they were either doing, if it was a church, a drive-in service, where there wasn't a mass gathering and other things, that there was just one violator yesterday. And we paid a lot of attention to the one. I want to talk about everybody else. I mean, how incredible is that? That all around the state, on any given day, statistically, we're having 0 mass gatherings. That's why, if you look at us versus other states again in what we showed, I mean, look at where we are. We put the stories and the dramatic stories of maybe the one out there. It's everybody else that's the story. I'm not sure anybody across the country has this type of compliance. So I'm grateful. I'm grateful for everybody out there for everything you're doing. And today I'm not going to give any more oxygen to those that aren't doing it right. I'm going to celebrate all of those that are. Okay, many questions about the Franklin County site today. How did it go? It went really well. We didn't have a lot of issues other than we could have tested more people. That's why we've opened it up to priority 3 and advised you that contiguous counties can also sign up. And so what we learned today is that Kroger can test the number of people that they were saying that they could test, and that's a good thing. It was also good to have a ramp-up day, even though they worked out a lot of the bugs when we did the proof of concept. Did Kroger reach out to the state, or did the state reach out to Kroger? They reached out to us. This was a program they wanted to do. We worked on it for a long time. It went through many different variations, but this was them. And they tried to work with multiple partners to get this done. So I'm very grateful for their work. And they also said they really wanted it to be in Kentucky and for Kentucky to be first. And my response was, me too. Mike?
The president appears to be growing increasingly anxious about possibly reopening the country, maybe as soon as even May. And today he signaled that he believes he has the authority to dictate when businesses and the economy can reopen in general. Have you had any conversations with anyone on the task force since that tweet was put out? And how much sway does the president have in your decision making?
So the question, I think, is primarily based on a tweet from the president that talked about when, and there have been, he's answered different questions, but he does an hour or two every day like I do, and there are a whole bunch of questions, and then we only get to see a little bit of it unless you've watched the whole thing. But at least the question being, he seems anxious to reopen the economy, and then does he have the authority or do we? I'm not in the president's inner circle or really any circle around him other than being a governor that's on the calls. I think we're all anxious to move past this, and I think we all want to give voice to that at different times. And I can understand that. I do think that the president, when looking at the data, when looking at how important social distancing is, when looking at what's happening in Japan right now, and we may see a resurgence of this in China, will ultimately determine that May 1st is probably not a realistic date. Now remember, previously he was aiming for Easter, and then when the data was different, he moved it. And it could be that his motivation is to keep us all very interested and engaged, wanting to know that there's a light at the end of the tunnel. I can't quite speak to that. But I have confidence in whether it's working with the different groups that we do, that ultimately where we are in the data at that point will guide his recommendations. Now, I don't know about the authority question that they asked. They've issued recommendations, we've issued orders. Our orders are a state deal, and I will want to collaborate with the federal government as much as possible. But at the end of the day, in this state, the buck stops with me, and I'm going to protect our people. There's a question about how much we're going to pay for our partnership dealing with Kroger. We don't pay them anything. I will get the numbers for what we're going to pay Gravity and UPS. What are the next steps rolling out the drive-through testing program? I can't believe I missed this in my notes. Wednesday, we're opening our second facility, and it's going to be in Kenton County. Kenton County's county judge and I were on the phone today. He is very excited and was very involved in this, everything from discussing different site selections to wanting to make sure that he talked about the tiering. This will be our second spot. Northern Kentucky has been hit pretty hard. Our goal is 250 a day. You can go ahead and start signing up, knowing that it won't start until Wednesday. I should have done this earlier. I meant to, but I make mistakes too. So again, if you're in Kenton County or surrounding counties and you fall in any of those tiers, make sure that you go online. We want to help you out. We want to expand the testing capacity there. Joe.
Stivers has said that they're not just going to override vetoes and deal with COVID legislation. There may be other legislation that they're also passing through along with the House. What do you want the General Assembly to do the next 2 days? What do you want?
So the question is, the General Assembly is coming back tomorrow. At least one legislative leader has said they may do more than look at vetoes and pass COVID-19 legislation, that they might spend even 2 days, right, passing legislation. We just passed our 100-death mark here in Kentucky. It is spreading everywhere, and any contact that we have could lead to another human being potentially passing away. Any mass gathering we have can spread it. And what we've got is a group of people coming from all over the Commonwealth and from places that are real hot spots, whether that's Jefferson County with what they have, which makes sense by population, whether it's Hopkins County, that we have all these people with their contacts in their community coming together. And what they should do is they should do only what's necessary and do it as quickly as possible. I mean, their actions are going to impact the lives of others around them. They're going to come into this Capitol with the flag at half-mast because of who we have lost, and they ought to only consider those veto overrides, and I'm fine with that. The only things that I vetoed were about flexibility. I didn't veto any full appropriation that they had, and where something I felt violated the separation of powers, where there was an all-new limitation that was thrown in somewhere. Anything else they shouldn't be doing, and I'm going to have a pretty high bar for anything else that they pass when just being here puts them at risk, puts their families when they come home at risk, puts their community around them at risk. You know, one of these legislators can come from a county that doesn't have a confirmed case yet, and guess what could happen here? So it's a very dangerous time, and I just want them to be as responsible as they can be. Let's see, we've seen some photos emerge inside the field hospital. We answered that one. Here's one. There's concern. This is going to be for you, Dr. Stack. There is concern with some medical staff that the self-administered COVID-19 tests offered by Kroger may offer a lot of false negatives because most people won't be able to insert the swab deep enough. Will someone be observing and talking to each patient, or what's our response to that piece?
Thank you, Governor, and thank you for the question. So there will be Kroger clinicians supervising everyone who administers the test. And so, yes, it'll be observed. There'll be instructions given to the patient. And I believe they have the ability, if they have to intervene to help the patient complete the test if necessary. So, yes, there is assistance in their supervision. And the testing, whether you do it in the deep back of the nasal cavity or whether you do it in the lower middle portion of the cavity, have different sensitivities and trade-offs, but we're doing all symptomatic patients. So if you have symptoms, the test should be very highly reliable still. But yes, there's always a risk for false negatives, but the test, we believe, should still be very useful.
All right. Phil?
Someone called our station with a question about filing small business taxes, and they were still required to file them by April the 20th, but I thought that they'd extended all those to July.
The question is about small business taxes, and at least one calling in saying that they believe theirs is due April the 20th. Let me look at that. Certainly my intent was to move all deadlines similarly. Now, some pay quarterly, some pay yearly. And again, I'm talking about individuals, but that's something I'll need to take a look at. And certainly my intent was to push it out. And by the way, that's gonna hit the state and our budget pretty hard. When you're supposed to typically pay them April 15th, and that comes in the fiscal year, and it's moved to later. I think it's July 15th, which is in the next fiscal year. That's a big deal on a state level, but it's just the right thing to do in this period of time. Franklin County Judge Executive Houston Wells and Frankfort Mayor Bill May have issued a nighttime juvenile curfew effective tonight. Am I considering doing that on a statewide basis? First, let me say I support our local leaders when they feel like they need to take additional steps. They know their community, and I want to make sure that I'm supportive, even when we have a different rule overall for the state. Right now, in my calls, the violations of social distancing, for the most part, aren't taking part at night. They're taking part in the middle of the day, especially when it's nice. If there were enough local leaders that talk to me about this, I'd consider it. But right now, we don't have any plans at all for a nighttime curfew overall. We're seeing, pretty good compliance with healthy at home across the state. Glasgow High School says they're working on 3 potential graduation plans for May 16th, virtual, small group, or normal. Do I have any guidance on whether I'll be making a recommendation on how to conduct commencements? We're going to go through this at least another week, and then we'll have some guidance on what we think will happen with the rest of the school year. What I've done each time is once we think we know if we need to not have in-person classes, I talk first to the commissioner. He gives me guidance on where our superintendents are and what his suggestions are, and then we do a full call with the superintendents, and we will do the same. I would, for every school out there, make all of those plans too. We at least have to be prepared if we don't come back to school. Mike?
Two-part question on employment. Can you outline any concrete steps the state government has taken lately to improve the system? And also, one of the callers to our station wanted to know that if unemployment benefits will be backdated to when they lost their jobs, or if they will lose compensation for the weeks they weren't able to access the...
Let me start with the second question. Unemployment, yes, is supposed to be backdated to when you lost your job, and certainly we're not going to make anybody lose benefits because of the record-breaking number of filings that sometimes mean it's going to take longer to get to them. We are moving our call center. The plans are to go from 12 people who used to answer the phones to 1,000 people. That takes some time to ramp up. They have more servers over there for the system than ever before. But here's one of the challenges, right? We had a computer system built out for what the law on unemployment had basically always been. And so, you put in your information, and if you didn't fall in one of those categories, it spit out a denial. And they've actually had to work on that programming and everything else that it did electronically just to try to stop those denials from going out. Then they had to build in all the other portions of the new people who are able to file, which significantly increases the volume. So basically, what we have is a total change in how to do something at the same time when the number of people that need it has increased, maybe not exponentially, but really significantly. So I'm proud of our group. They're working really hard. But again, anybody out there who hadn't been helped yet, you're right. There shouldn't be any excuse, even though we've never gone through this before. We will get to it. Every day we hear from folks that were frustrated, that it was taking too long, and it was. And then we finally got it to you. Now, a lot of folks that we receive complaints for, and they're rightful complaints, actually get their first payment before they get that letter in the mail. But we'll get another update on this. It's an important issue here soon. Any update on Senate Bill 2, the photo ID bill? The legislature is coming back in, and they may override that veto. But here, whether or not that you think you should have to have a photo ID to vote, whether it protects the system or whether it prevents people that should be able to vote from voting. So right now we're in the midst of the coronavirus, and you can't get in to get a photo ID. You can't. The offices are closed, meaning if there's a photo ID requirement and we're still in this, when whichever election comes up, you won't be able to vote because you won't be able to get a photo ID. So if this is something that the legislature wants to do, at least do it starting in an election after this year. Let's not create a rule at a time when nobody can satisfy the rule. I mean, driver's license will expire and we're extending them, but it's for the exact same reason. Joe.
Have you spoken with Secretary of State Adams about how the primary election is going to be conducted? And is there anything close to an agreement with his office? And did you observe Wisconsin last week in their primary election? And does that inform your view of how Kentucky should go forward?
There's a couple-part question. Did I observe Wisconsin's election last week, you can't put people in that type of danger. I mean, in-person voting, right, in the middle of the coronavirus is wrong. We have had conversations with Secretary Adams. My team has had conversations with Secretary Adams. I hope that we personally will be able to do that. We've had good conversations. They've gone back and forth. We're not in the same exact place, but we are certainly in the same ballpark, and he has been willing to talk about it. I know, and we both believe that there need to be significant options to vote without being present. The question is, what should the options about being present mean? There's certainly some points for those with certain types of disabilities that may have to vote a certain different way, but I want to make sure, I want to make absolutely sure that our typical poll workers are not exposed to this virus in the way that they were in Wisconsin. I'll take one more from the folks that are here, and then we will wrap up for the day.
I don't think I have anything else.
All right. All right, Mike, anything else? All right. Only Joe Sonka.
Question for you or Dr. Satt, whoever wants to take this. Is there anything that the state can do or is specifically planning to do to stem the disproportionate COVID-19 death rate along racial lines?
The question is about the disproportionate death rates along racial lines. We've got a group that's analyzing that right now. You know, the data, we weren't tracking this data well enough from the beginning, and we weren't the only state. And I think a lot of it has to do with access to health care, and we're trying to do something about that right now as we're moving through opening up Medicaid and the rest. But I think more needs to be done. I think we need more education, certainly more outreach, but we also need to listen. That's one of the things that I hope to be doing this week is listening to leaders in the African American community on things that we think that we should be doing better. We need to have some more direct connection, and especially specifically on the coronavirus and health, to make sure that we are connecting people and providing the information to those anchors in that community that are able to spread it further. It's very concerning. It's concerning that the death rate is disproportional. It's also concerning that the death rate is higher than the total number, than the percentage of cases as well. And just because it's probably for a lot of reasons, mainly all reasons, that we're here before the coronavirus hit, doesn't mean that we shouldn't be doing things about it during the coronavirus. And I really hope afterwards. You know, I don't want to sound like I did before all this, but I believe healthcare is a basic human right. And what we're seeing right now is people die when they don't have equal access to healthcare. All right, folks, I want to thank you. I want to thank you for your service to the Commonwealth. In this, the challenge to our times, you've stepped up, you have performed admirably, and we need you to keep doing it. This is one of those grueling, long, anxious-filled challenges. We don't know exactly when it will end, but we know we're talking about months and not years. I need you to stay strong. I need you to stay resilient. Every day you do the right things, you protect people around you. I believe that years from now, we're going to look back and we're going to be very proud of what we have done. So I will see you tomorrow at 5. We don't have a video today, but I'm looking forward to providing an update tomorrow. Let's remember, 104 Kentuckians, people we love, people we care about. Light those houses up green. Our flags here at the state capitol are going to half-mast. Thank you. Thank you, Virginia.